Hello, this is Marla Dalton, Executive Director and CEO of the National Foundation for Infectious Diseases, or NFID. The Centers for Disease Control and Prevention, CDC, recently updated its guidance on masking and launched a new tool to help communities decide what COVID-19 prevention steps to take based on the latest data. With me today is NFID Medical Director, Dr. William Schaffner, to help us understand the current guidance, explain a bit about these COVID-19 community levels, and most importantly, whether we need to continue wearing masks. So thanks again for joining us, Bill.
Marla, it's good to be with you, and we'll face this mask issue head on. Ooh, double pun.
Perfect. So Bill, a lot of the recent media coverage seems to focus on the fact that most people in the US don't need to wear a mask indoors according to the new guidance, but it's really not that simple, is it? Can you help us understand why?
Well, it is a bit complicated. We are a large, diverse country, and some areas are moving more rapidly than others, even exceeding the CDC guidance, which of course has designated areas of transmission as high, medium, and low, which should be a general guidance. But even in those areas, and I would like to emphasize this, that are moving to quote, remove the masks in various circumstances, schools, restaurants, attendance at museums, and the like. I think we ought to continue to respect people who choose to continue to wear the mask. It should be really mask optional. And why is that? And that's because there are many people, older persons, people with underlying illnesses, heart disease, lung disease, diabetes is so very common. And of course, those persons who are immune compromised. I'm talking about this large group of people who live among us who, should they get infected with COVID, are at increased risk of severe disease. They still could get hospitalized after infection with COVID, even though they've been vaccinated. And so they may wish personally to continue to wear the mask in public, especially indoors. And I would plea for not only tolerance, but support of people doing that. We need to be respectful of our neighbors who need to be more cautious.
And probably those that want to be cautious as well. So I think that's really good advice. I'm going to shift gears a little bit because there are reports now of many schools shifting to a mask optional policy, even though COVID-19 community levels may be high in the area. So what advice would you give to a local school board?
Well, that's a tough question you've given to me because it is fraught. But I would hope that local school boards consult with their local health departments and come to some sort of an agreement. And then if local school boards, some of them get ahead of their skis and wish to remove the masks, for example, even if they are in high transmission areas, once again, I would say, make it mask optional so that students whose parents wish them to continue to be cautious are permitted to do so, whether just because they wish to be more careful or because they have an underlying illness. Let's support our neighbors. Let's not make this a contentious issue.
Perfect. So Bill, just digging a little bit deeper in there, what does the change in masking guidance mean for those who are at higher risk for serious illness due to COVID-19, based on health conditions, et cetera?
Well, it's important to reinforce this notion. Omicron is widely contagious and it can infect people, usually making them mildly ill if you've been vaccinated. Of course, if you've been unvaccinated, then you're at risk of more severe disease. Now, there are many people who live among us who have underlying illnesses, who are frail, who are immune compromised, or folks who just wish to continue to be cautious, who will like to continue to wear the mask. So these folks may have to explain that to people, but I would urge the rest of us to not make this a contentious or a querulous issue, but to support and I was going to say tolerate, not only tolerate, but really support people who continue to wish to wear the mask, not give them a hard time.
Exactly. And so, Bill, in summary, I suppose, what steps should we all take now, regardless of our COVID-19 community level? And frankly, I think there's still some question out there. The science behind the masks is still clear, correct?
Oh, yes, the science behind the masks is clear. We are moving in the United States in a sustained fashion from pandemic to endemic. And lots of people are curious. So what does that mean? Well, for sure, it means that all of us, in order to keep this virus down, to reduce its impact on all of us in our populations, we should be vaccinated. And that applies to adults out there. It applies to parents to take their children age 5 and older in to be vaccinated. We still have many people who need to initiate their vaccination series. And those of us who have been vaccinated, it's time to get your booster if you haven't done that. So that's critical. Another is, should you become ill with a respiratory infection, please get tested. Find out if you have COVID. This is particularly apt for people, once again, I'm going to say, who are older, frail, have underlying illnesses, are immune compromised, because you may well be qualified, should you be positive, to receive the antivirals or the monoclonal antibodies, which will help keep you from getting serious disease. That's very important. And then the last thing I always say is stay tuned. COVID changes from time to time. We have to keep up. And it may well be in the future, at some interval, we may all have to get a booster. That hasn't been decided yet, I hasten to add, but who knows? Let's all stay tuned, and we'll keep up and keep ourselves protected.
Well, and I think in that spirit, even if you decide to go mask optional now, it's probably a good idea to keep the mask at hand in case those mask mandates return based on the fall respiratory season.
Oh, there isn't any doubt. I think you will see many people, even if it's an outbreak of influenza, put the mask back on and begin social distancing again, because they know that that has worked and will protect one from acquiring infection and getting more severe disease. So I think we'll see more mask wearing in the future, just spontaneously. We now in the West have become used to almost mask wearing, whereas people who live in the eastern part of the globe have been doing that for decades. During influenza season, many people just wear a mask.
Perfect. Bill, thanks again, as always, for your valuable insights. And as you said, as the COVID-19 guidance continues to evolve, we will look forward to a continued discussion on future episodes of the Schaffner Report. Thanks and have a great day.
Bye-bye.